Okay, guys, so let's talk about this patient. This patient has Cushing's disease. Cushing's disease is when the person has like hypersecretion of the adrenal corticoids. They're secreting way too much glucocorticoids. Specifically, they're secreting way too much cortisol, which is a type of steroid, right? So, a couple things you have to keep in mind. Cortisol is very sugary, right? Steroids are sugary. So any patient that is making way too many steroids, we always have four concerns when it comes to steroids. Infection, places the patient at risk for infection. Ulcers, they're very hard on the stomach. They cause stomach ulcers. Osteoporosis, they cause the bones to be porous. And what's the fourth thing? Steroids. They're sugary, hyperglycemia, osteoporosis, infection, and stomach ulcers, okay? So that's for any type of steroids across the board. But let's talk specifically about this patient that the adrenal glands are releasing way too much cortisol. So the blood sugar is going to be high. Also, another thing about steroids, they tend to make you hold on to sodium and fluid. And so the patient will tend to always look swollen. They're holding on to all their fluids instead of letting it go. So the sodium's going to be high. Guess what's going to be low? Potassium. Remember, sodium and potassium have an inverse relationship. So most of the time, if that sodium is high, the potassium is going to be low. So what else do we need to know about this patient? You're going to see that they have what's known as the moon face, or that buffalo hump, that pocket of fat that you see behind their neck. And what happens is that cortisol also causes fat redistribution. And so you'll see those pockets of fats where it shouldn't be. You'll see that central obesity where you'll see the extremities are thin. You'll see paper thin skin, and they can have purple striae, and that has to do with the blood vessels become very fragile. It's vessel fragility. What else? Sexual, what's the word I'm looking for? Dysfunction. Patients with Cushing's disease, they tend to lose their libido. If it's a male, they tend to be impotent. If it's a female, they tend to have hirsutism. They'll have grow a mustache or a beard. They tend to have amenorrhea, and also male, they tend to have gynecomastia, which is, the male boob. So these are some important things to know about Cushing's disease.